In this lecture, we're going to talk about positional release, the theory behind it and how it is carried out. This can be a handy technique. Once again, there are many books available on the topic, all with slightly different variations. With any technique, you will find the version that works for you, as long as it is safe and effective. This technique is a neuromuscular technique looking to reduce spasms, pain, tightness, and potentially trigger points. It will promote muscle relaxation and local circulation. Positional release is a far gentler technique than trigger points, soft tissue release, and many others. It will be useful for clients in a huge amount of pain or who are vulnerable. It might be a gentle technique, but if delivered effectively can be very powerful. This technique is designed to reduce hypersensitivity and hyperactivity in the muscle spindles. There are various effects of positional release, including reducing neuromuscular excitability, increased flexibility and contractibility of the area, improved range of movement, reduced local and referred pain, increased circulation, increased local and general relaxation. The technique is simple, but you do need to understand your muscles well, as this will help you to get the muscle into the right position. You also need to have strong palpation skills and patience. You will need to make sure you are in a position that you can hold for a long time. You start by locating the area of issue, then apply pressure to a reasonable but not excessive depth. Find out from your client what the pain is out of 10. You then need to passively move the client into a position where the pain is eased or gone. You will start with big obvious movements, then fine-tune at the end with slight adjustments. Once you have it right, you can reduce the pressure you are applying, but do not remove your hand. Hold this position for 90 seconds. When you have finished, gently release the pressure altogether, but do not move the hand, and then move the client back into the starting position. The pain should now be reduced or gone. The direction you move the client in is with the direction the muscle contracts, not into a stretch as you would with soft tissue release. The goal is to try and get the area into a position of ease where there is little to no pain to allow it to release itself. The technique takes time and practice. With many of the techniques, you will find certain ones work better in certain areas or on certain issues. Sometimes it comes down to experimenting. A quick note here, you wouldn't use this and soft tissue release in the same treatment on the same area. You can now complete the quiz questions associated with this section and move on to the demonstration videos.